have to interpret chest X-ray. Mnemonic that is A, B, C, D. Follow this mnemonic A, B, C, D, E to interpret chest X-ray so that findings are not missed and picked up properly. What is meant by A? A is airway. So airway includes trachea, bronchi and lungs. Isn't it?
Yes.
This is the airway. So airway means trachea, bronchi and the lung fields. So first A is for airway, and you have to look any problem in trachea and in the lungs. What problem can be picked in trachea? There may be tracheal deviation to one side or the other side because of a large goiter or some mass in the neck. So there may be tracheal deviation. What problems are there maybe in the lungs?
Inflation.
What problems you can see in the lungs?
Pleural effusion. Inflate.
As you have seen earlier, pleural effusion, pneumothorax, hemothorax, blunting of the costophrenic angles, opacities, metastasis, patchy infiltration. So these are all findings you can see in the lung field. So airway, first is
Airway.
airway, trachea and lung fields. Then is B.
Breathing.
B stands for
Breathing.
B stands for bones, because chest includes bones, chest X-ray includes bones as well, and there may be fracture of bones. Bones are clavicle and ribs. So have a look on ribs and clavicle and head of humerus. So bones in this X-ray seems to be normal. So airway and bones. Then C. C is cardiac shadow. Right? Cardiac shadow. When we will label that cardiac shadow is enlarged. So you measure cardiac shadow, and if this cardiac shadow is more than hemidiaphragm, half of the chest, then heart is enlarged. Got my point?
Yes.
I repeat. On chest X-ray, you measure the shadow of the heart. If that shadow is greater than the lung, one side of lung field, or it goes across the midline, then heart is enlarged. Notice? Got it?
Yes.
It's clear? Okay. So C is
Cardiovascular shadow.
cardiac
shadow.
shadow. And commenting on cardiac shadow, we can say that heart is enlarged or not. What is D?
Diaphragm.
Sure.
Diaphragm.
Very good. D is
Diaphragm.
So you can see the diaphragm here, diaphragm here. On left side, can you see these air bubbles?
Yes.
And where are these bubbles on right side? No air bubbles. So on left side, the presence of air is normal because of air in the stomach. Because of air in the stomach, you can see air under the diaphragm. But on right side, air under the diaphragm is always pathological, abnormal, because of some perforation of some viscus or viscera, like perforation of duodenum, like perforation of eye. Secondly, when liver is enlarged, what will happen to diaphragm?
Raised.
Diaphragm will be raised. Okay? So if whether diaphragm is raised, whether there is air under the diaphragm, you can see in chest X-ray under that heading D. What is E?
Epigastric.
No.
Esophagus.
No. extrapulmonary tissue. This tissue around the chest. Okay? What happens in a rib fracture? The air traps in the soft tissue in the chest, and that is called surgical emphysema. Emphysema is entrapment of air in subcutaneous tissue because of fracture of ribs, because of trauma, penetrating trauma, blood penetrating trauma. Right? So that surgical emphysema is picked by small dots, air in subcutaneous tissue. So that is also checked in the chest X-ray. Okay? So A for airway, B for bones, C for cardiac shadow, D for diaphragm, E for trachea is deviated. There are metastases in the lungs. Cardiac shadow is enlarged. There is free gas under the diaphragm, and there is surgical emphysema or air in extrapulmonary space. Okay, got it?